Hello, and welcome to the Center for Interdisciplinary Health Workforce Studies Spring Webinar event, focusing on the latest trends and research in the nursing workforce. We are pleased to have all of you joining us for today's webinar. A few center announcements before we continue to make you aware of. First, Peter Buerhaus, David Auerbach, and Doug Steger have just published a new article entitled Recent Changes in the Number of Nurses Graduating from Undergraduate and Graduate Programs in the Journal of Nursing Economics. You can find the full write-up of most trends on the Center's website this week. But because we don't want you to have to wait to learn about those trends, our webinar speaker, Dave Auerbach, will cover some of the major trends in nursing during his presentation. Second, today we are releasing new data on RN employment. Look for a posting on the Center's website that shows the fourth quarter 2015 national employment figures for the RN workforce, plus some information on the age distribution of RN. And Dave will also cover these results in his presentation, but if you'd like to visit the figures, they'll be on the website. Again, the website address is healthworkforcestudies.com. After Dave concludes his presentation, we will have about 15 to 20 minutes for discussion and question and answers. Please feel free to type any questions you have in the area designated for questions on your menu bar, and we will get to as many as we can. We are also recording the webinar today and we'll have it posted to our website. We have posted all of the previous webinars to our website, including last fall's value presentations, if you missed any of our previous webinars. You can also find presentation slides for many of the webinars posted within the event calendar invite on the Center's website as presenters allow. Today, we have a timely presentation focusing on recent employment trends in the nurse labor market and forecast of the future national and regional supply of RN. Now, I would like to allow Peter Buerhaus, Center Director, to take a minute and introduce our speaker, David Auerbach. Pete.
Hey, thanks, Christy. Yep, this is Peter Buerhaus. I'm broadcasting from our Bozeman station here in Bozeman, Montana, where it's beautiful blue skies out, high temperatures in the mid-40s, and yesterday morning I saw a bald eagle fly by, and there was more white on this bald eagle than there are on the mountains in the distance. But so it's a good-looking situation here in Montana. But more importantly, I want to introduce a friend and colleague, Dave Auerbach. And for those of you who may not know, Dave received his PhD in health economics from Harvard University in 2002. And since then, Dave has worked as a principal analyst at the Congressional Budget Office in Washington. He was a senior policy researcher at the RAND Corporation, and then recently, about a year or so ago, became the Deputy Director of Research at the Massachusetts Health Policy Commission in Boston, Massachusetts. On a more personal note, I'd like to mention that for the past 15 years, Dave has been working with me and Doug Steger at Dartmouth on all things nursing workforce. At last count, we have published, the three of us, 33 peer-reviewed journal articles, one book, and many of these publications, Dave has been the first and lead author. Dave manages the construction of many of our data sets. He frequently leads the analyses of these data. He develops the team's manuscripts for publication, and he's prepared a vast number of write-ups that we post on our center's website. Dave Auerbach is an incredible resource to the nation. I've learned so much from him, and it is really hard to describe the value that he brings to our team, but more importantly, to all those in the larger health workforce community. So it is a truly great pleasure to now turn the microphone over to my colleague, Dave Auerbach. Dave, it's all yours.
Great. Thanks, Pete. That was a great intro. And I'm really happy to talk about this topic today, and I'm glad a number of people are tuning in to listen. There's some interesting things going on, and we've got some fresh new data to show you through the end of 2015, in fact. So the title is Surplus Shortage, National and Regional Trends in the Nurse Labor Market through 2015. Okay. So I wondered if, Pete, I don't know if you want to come back in and just give a little bit of the context and some of the impetus for even giving this talk now. There's been some some interesting articles in the press, and you've had some meetings with some folks.
Yeah, Dave, I blew it. I was supposed to say that in the intro.
No problem.
Yeah, I think as many of the folks listening in on the webinar are aware, we've been hearing some reports, some increasing number of reports from newspapers and articles in the popular magazines talking about nursing shortages. They seem to be breaking out. People are increasingly concerned about the retirement of nurses, and this has been getting a lot of tweeting and movement around the country. The leading temporary staffing firms are reporting continued high growth in employment, and our team a couple of weeks ago started to pay a little bit more attention about this and wonder, are we missing anything? Is there something going on that we're not seeing? And so this really became an impetus to ask Dave to lead us through what his analysis shows in the team's analysis.
Okay, great. Yeah, and I'm sure that many of the folks in the audience have seen or heard some of this. So we wanted to really see what we had in the data and see what we could bring to bear on this topic of, where are we now and where are things going. Okay, so to start, I want to again go back a little bit in time and give you some of the context for the really interesting phenomenon that we all know and love going on in the nurse labor market, which is the large baby boom cohorts. So to orient you to this picture, first just look at the 1985 or the blue line. And what we have here is the nurse workforce divided up into age groups. On the y-axis is the number of RNs, and on the x-axis is different age groups. So for example, on the blue line, this shows a picture of the workforce in 1985. And you can see that at that time, there were about 250,000 RNs between the ages of 25 and 29. And you see a similar number between the ages of 30 and 34. You'll see that that blue curve has kind of an interesting shape. It's an unusual shape. And this is really because you had this very large baby boomer cohort of mostly women entering the nursing workforce in the 70s and 80s. And if you were going to the hospital in 1985, you were very likely to meet most of the nurses on your ward were going to be between the ages of 25 and 34. So that was the phenomenon at the time. Then about 15 years later in 2000, look at the red line, and first of all, you see that those same large boomer cohorts, I've also highlighted them again in that kind of orange glow. They were 15 years older. Now they're in their 40s. And that's the bulge there at the peak of that graph of the red line is in the 40s. Those are pretty much those same folks, and they were dominating the workforce again. And what was somewhat alarming to workforce researchers was the fact that they now go back on the red curve to the ages of 25 to 34, and you see those red points are below the blue. That means that the number of new nurses coming into the workforce, number of young nurses, in the year 2000 was actually below the number that we saw 15 years earlier. That said to us, wow, it looks like there's going to be a problem. We're having less entry into the workforce than we did before, and if you played that out, the models, all that were being produced at the time, tended to show, in the long run, once those baby boomers retire, the workforce is going to shrink, if nothing else changes, because you had smaller groups coming in behind the bigger groups. And then you can look ahead at the green curve, 2015, just last year. Those same baby boomers are now in their 60s, and many of them are starting to retire. We always knew that was going to happen. And again, the picture in the year 2000, if nothing else changed, we saw this coming a long time ago. There were going to be these big retirements, and if nothing else changes, it looks like we're running into a problem. So on the next slide, we're showing that in the year 2000, when we did these forecasts, we predicted, and others did as well, that there would be shortages of about 500,000 RNs by the year 2020. And here we are today, we see the oldest boomers at around age 70. So retirements have started. And of course, those forecasts at the time assumed that the previous patterns of retirement that we had seen in the workforce over the years and patterns of new entry into the workforce would stay as they were. As it turned out, however, that isn't what happened. Excuse me, there's a little, okay. Sorry about that. So that is not what happened. And now I'm going to show you how the world changed since those forecasts were made. And it is partly because the retirement patterns changed. They weren't exactly what we saw before. And on the bottom, I'm showing you a paper that we published describing how those retirement patterns shifted. And that accounted for a little bit of the change. But much more important was that new entry into the workforce had a markedly different pattern than it did up until the year 2000. Here's a curve showing in a simple way what happened in terms of new entry. Here we're showing the number of nursing degrees by type, and it's not as important, the red versus the orange. We'll get into that a little bit later. But the total number of people graduating from nursing school had been dropping in the late 90s to around 60, 70,000 by the year 2000. And then it just skyrocketed over the next 15 years. It's more than doubled. That is a change that we really didn't foresee at the time. And you can see that another way by looking at the number of people taking the NCLEX examination, which is required to practice as a nurse. Same pattern, dropping through the late 90s and then skyrocketing, more than doubling over the next 10, 15 years. So when you take that change into account, now I'm showing the full 2015 age distribution of the workforce. Before I had covered up those 3 points in the top that are circled in the blue, but now you can see that the number of nurses at those young ends of the age spectrum, ages 25, 30, 35, is way over what it was even at those high baby boomer cohorts in the 80s. As it turns out, the total number is about 250,000 more young nurses observed in the workforce than we thought there would be in the year 2000. And that has largely erased, or done to a good extent, erased the shortages that we thought we would be having by today. So to be a little, to look at that in a different way, what we did was went year by year and analyzed, approximated the number of RNs who entered the workforce each year and those that left the workforce each year. And you can see the new N in the blue, and those leaving the workforce in the red. So if you just focus on the red for now, you see the pattern of retirement that we knew and expected a long time ago and that we predicted and that everybody knew was coming. Those red lines get bigger and bigger as you go through the 2010s, the 2020s. Those are growing numbers of nurses retiring and leaving the workforce. If those blue lines had stayed the same as they were in 2001, say 70, 75,000, if there was no increase or no change, we certainly would be in a period of, we'd be looking at a workforce that was almost staying the same size because those red lines are catching up to that 70,000 level. But again, the fact that those blue lines, the new entry into the workforce, didn't stay the same, but it grew throughout the 2000s and is continuing to grow. That means that the workforce is still growing in size. As long as entry is greater than exit, you have a growing workforce. So what we did was, in a paper that we published, I believe last year, combined in the model all of the trends that I've just shown in the last few slides, the entry, the exit, the age distribution, and the model that we have is very good at trading off those different forces and weighing the effects and bringing them all together and seeing what ends up 10, 20 years out into the future. So as a result of all that, we saw about 2.7 million RNs in 2013. I'm looking at the top row of the table. That's supply, and it's common practice to consider demand as the same as supply in the starting year. So there's demand, same level in 2013. We project an increase in the number of RNs of about 400,000, bringing in the year 2025 to about 3.1 million FTE, and then about 3.3, 3.4 million by 2030. So that's a pretty big growth in the workforce. And even when you divide it by the U.S. population, you have a substantial increase in FTEs per capita. And when we compared that to demand forecasts made by HRSA, because we have generally not done a lot of work on the demand side of forecasting, but mostly the supply, we found that we were looking at something like a 4% shortage of RNs of 120,000 by the year 2025. So that new entry, the growth in new entry combined with the retirements that we're starting to see, combined with increase in demand, pretty much balanced out, fairly close. When HRSA did their own supply projection, they actually found that it didn't quite balance out, that there was even more supply than the growth in demand, and they found a small surplus. So at this point, at least in the national sense, and in the future, as long as new entry into the workforce continues to do what it's been doing and doesn't somehow collapse, we're not looking at shortages, certainly not big shortages. Again, another caveat is that those HRSA forecasts of demand are roughly right. Okay, so that's the national picture. At the same time, it's not to say that there aren't going to be problems in some areas of the country, in regions, in states, or especially in small local areas, because you have these very big forces of large numbers of baby boomer RNs on the cusp of retirement. You have large numbers of new graduates coming into school. Of course, that's not going to be a balance everywhere at the same time. Some areas are going to have too much entry, not too much, but a lot of entry relative to exit. Some areas will be the other way around. But what we did do is let's at least look to the extent that our data allows, regionally, to see if we see differences in these patterns, and we're going to look right up until the very end of 2015 to see if there seems to be something happening just in the last year, the last few quarters. Okay, so the next couple of graphs are the regional picture, and they're a little bit messy, and it's kind of hard to see a very obvious pattern, but it gives us a little bit of insight. I mean, the bottom line, I would say, is that we don't really see an obvious shortage area at the level of a region. Unfortunately, our data allows us to only drill down to the extent of dividing the country into 9 groups. And you see on the right those groupings of states that the census uses when it's creating divisions. And we're just showing the supply over the last 7 years for each of those 9 regions. You can see, for example, on the top, the DC, Florida, Georgia, Maryland region. It just happens to be constructed that that's the largest number of RNs out of all the regions here. And the trends are, for the most part, drifting gradually upward, same as the overall trend in RN supply. You can see, for example, something that stands out to me is the Arkansas, Louisiana, Oklahoma, Texas region really zooming up in supply quite a lot. There's a substantial growth there, and we would like to understand a little better what's going on in that area. But nothing super striking in this pattern. But something else we wanted to look at is an indicator of a region that might be having a shortage is the combination of, do they have rapidly rising wages and falling supply? That could say, oh my gosh, there's something going on in this area. They can't get enough RNs. Hospitals are raising their wages to try to bring new people in. Do we see that pattern? So then we looked at wages in those same regions. Unfortunately, the bars are not colored in exactly the same way as the previous slide, but I'll point out that here, kind of as before, there's a lot of bouncing around. The data is a bit noisy. And in general, we just see a pattern of wages being relatively flat or even drifting downward. These are real wages that are adjusted for inflation. And when I looked at all the 9 regions and we kind of, poured over what was going on, there was maybe just one area where we saw a pattern of wages that seemed to be going up in the last couple of years with a stagnant supply, and that was the same Florida, Georgia, Maryland region. It's colored in blue, it's a kind of turquoise blue on this slide with the wages going up a little bit, and the previous slide had supply flat in a couple of years. But again, these are very big regions with multiple states, and the kinds of shortages that people are reacting to are sometimes at their own very hospital, their own specific market area, and we don't have that degree of granularity. But one more thing that we felt we could do as an analysis to add to this picture was to look at, well, what is the age of RNs in each of these regions? Some regions are going to, might have a cluster of RNs who are towards the retirement ages, or at least a difference in the number who are near retirement versus the number who are newly entering the market. And that could give us a sense, again, of maybe not what's exactly happening today, but in the near future. So that's what we did here. The blue bar shows for each of these same regions what percent of the RN workforce is under 40, whereas the red bars are the percent that are over 50. And we've sorted them from left to right by the percent that are over 50. So on the left, you see the oldest regions, and on the right are the youngest regions with respect to their nurses. And then we did separate forecasts for each of these regions. And the gray bar shows the expected growth in nursing supply between now and 2030. And here you do see an interesting pattern, and it's not surprising. Let's stick again, for example, on the left. The New England region has the oldest nurses out of all the regions, far more that are over 50 than are under 40. And not surprisingly, the model shows that we expect the smallest growth in supply over the next 15 years in that region, just about a 5% growth. So they are not really getting the degree of new entry as in many of the other regions. And a lot of those nurses are nearing retirement. And in contrast, on the other extreme, you have the region to the far west of the country, California, Hawaii, Alaska, Oregon, Washington, where there are quite a few more of the younger RNs than older RNs, and they have forecast a very high, more than 50% growth. So even if some of those pressures might be being felt across the regions of surges in retirements compared to the number of available new RNs. And we'd love to hear any audience reactions or points if anyone is observing differences based on where they are. Okay, now I'm going to focus a little bit more on the data up to the most recent quarters. First, I'm just showing the national supply year by year over the last 30 years. And the only point I want to make here is this, what Pete talks about as well. Healthcare has been through so many changes in the last 30 years. It's just kind of remarkable that the workforce, you could just take a piece of paper and put it to that graph and it's almost a straight line. It seems fairly impervious to the kinds of recessions and overhauls and upturns and downturns in the economy. It's kind of impressive. The nursing workforce just finds a way to keep chugging along. So that's where we are in total supply. Now I'm going to zoom in to the last 10 years and look quarter by quarter. And we're dividing that picture into RNs employed in hospitals and those employed in other places. And this piece is going to be published on our website, if not now, in the next couple of days. And we've been providing these kind of updates as the data comes, and they are quite helpful. And here you see, we were wondering if we might see a drop in hospital-employed RNs, which could be triggering some of the observed tensions or difficulties in recruiting and in hiring. And with the exception of the last quarter, there's not an obvious pattern of a drop there. RNs employed outside the hospital, just overall, that supply has been fairly bouncy but sort of flat lately. And we were a little bit surprised to see, actually, that in the last couple of years, RNs in the hospital seems to have been going up. We all kind of thought that the Affordable Care Act might start pushing some of those jobs more into the ambulatory care sector or other places, but we haven't really seen that yet. We also looked by age, again, the quarterly picture for the same 10 years to see, is there maybe a drop-off in the number of older RNs, maybe showing a big surge of retirements lately, but we don't see that at all. The green bars are the RNs age 50 and over, and there has been no obvious change in that pattern or no drop-off. So those have been fairly steady lately. Finally, something else that we looked at, partly because it could be related to supply disruptions, but it's certainly an important and interesting aspect of the nursing workforce lately, is changes in patterns of education. Specifically, the question here, there was somebody suggested to us, well, maybe you're seeing a drop in available RNs as lots of folks who had been associate degree RNs are suddenly shifting to get a BSN, knowing that a lot of hospitals and employers are really starting to require that these days. So we wanted to look a little bit more and see what's going on there. And here's one fact that I will mention also as something that we have been seeing, just to kind of reinforce that point of perhaps the preference for BSN RNs, which is related to the IOM report, The Future of Nursing, that came out 5 years ago and was recently had an updated report. Here we see the percent of RNs working in hospitals by degree type, and this is by the highest degree obtained. And the percent of ADN RNs working in hospitals has just steadily dropped from about 65%, to around 60 in 2014. And you don't see the same thing at all. It's the other way for the BSN employed RNs. It certainly does support what we observe hospitals starting to do more and more. And now we wanted to look at data right up to the minute, including 2015 patterns of education. And here again, we're looking at the number of those taking the NCLEX exam by which degree, by which program they were in. And here you do see something very interesting, that just in the last couple of years, after many years of really strong growth, the number of ADNs doubled from 2002 to 2013, but now it's actually started to drop. And it's, this is partly, I'm sure, partly related to the same kinds of trends that we just showed, where the job market outcomes for associate degree RNs, people are probably getting that message. It might just be a signal to say, you know what, you'll do better if you're in a BSN program. The BSN number of test takers has not dropped at all. It's continued to go up steadily. And here's a really striking graph, but now we're counting the numbers who are enrolled in those programs where you can, they're sometimes called RN to back, or you can convert from an associate degree to a BSN program. Sometimes these are part-time programs that people do while they're employed, and this is really something like exponential growth in the last few years. So it is possible that supply, the number of working FTE RNs has been temporarily suppressed a little bit with a lot of activity of folks going back to school. This number is approaching 50,000 these days, but it's hard to really know how important a factor that would be. So, in summary, despite reports of local shortages, we don't see anything in the national or even at the level of 9 regions in the U.S. that would suggest that as an important trend. And we also don't see something like that occurring in the future. When we do our forecast, which, again, I'll note that our forecast assumes that entry continues at the level that it has been in the last few years. We don't see large shortages coming on the horizon. But despite that, it is certain that there are going to be differences in the regions. We showed you that the nursing supply, the nursing stock in some regions is much older than in others. That's going to be important. And it's always going to be true that the variation, as you get into smaller and smaller areas, there's just more variation in experience. Certain areas are going to have very different patterns of these things are affected even by market consolidation and changes in healthcare delivery. It's really hard to put it all together and to know exactly what's causing what. And as we know, nursing education is in flux, and that is probably going to lead to some instability and some changes especially in certain areas of the country. Okay, so that ends the presentation part of the webinar. I hope I didn't go too fast, but we have plenty of time for questions from Pete, Christy, or the audience.
Great. Thank you, Dave. That was a great presentation, and I can tell that we're going to have a lot of questions about this. So if you do have a question and you haven't already logged it, go ahead and take just a minute to go under the questions portion of the toolbar and put your question into the queue, and we'll try to get to as many as we can. Before we start into that, traditionally I like to give Pete the opportunity to ask the first question, so I will defer to Pete now to ask the first one to start us off. Pete?
Thanks, Christy. Dave, thank you very much for the presentation. And I'm just curious, you didn't mention health reform too much here, but gosh, here we are, we're looking at a political election, which, you know, this is always sort of front and center about where the candidates stand in terms of what they would be thinking about should they be elected with regard to the Affordable Care Act. So I'm just wondering if you could share with us what your thinking is about the effects of the ACA and health reform on the nursing workforce.
Sure. That's a great question. And let me just also say I was pausing in the middle of my talk earlier because there was some commotion going on outside my door, but it seems to have gone away. But I think now we're fine. So yeah, people ask that a lot. The Affordable Care Act is the biggest change in healthcare, you know, perhaps since 1965. And what do we think is going to happen? And there are a number of groups that have tried to address that question in different ways. And I've been in some discussions where folks have tried to estimate, you know, on one level, just thinking of the newly insured, you know, 20 million people, you know, will be using more care than they did before. How much do we think that's going to increase the demand for nurses overall? And when people you know, do different modeling efforts to try to figure that out, they'll get different estimates. You know, the center of those seems to be not really earth-shattering, but on the order of a few percent of perhaps increase in demand for RNs. So I think that's a factor, and I think that HRSA does include that in their demand forecast. But I don't think that is the biggest effect of the ACA itself. I think the bigger effect, which unfortunately is also the more unknown effect, is how the Affordable Care Act will change the way we deliver healthcare and the incentives facing healthcare organizations, and how that will affect the kinds of workforce that they need and the roles that they need. And that is really a question that we're just trying to wrap our hands around. And I would put a pitch for Academy Health. For those of you on the phone who are going to be attending, there will be some good sessions in the workforce session that'll try to address this. And something that, you know, there's been some work by folks such as Polly Pittman looking at how are ACOs using RNs, maybe as an indicator of maybe this is the leading edge of the future that is eventually going to trickle down throughout. And there do seem to be new roles, new need for RNs in ambulatory care settings and care management settings, some of the kinds of things that where organizations couldn't get a reimbursement fee before, you know, maybe couldn't bill for some of these activities like managing care. Now with more of an ACO or a prepayment type of structure, they are able to hire more RNs to do that kind of work. So I think a lot of people have expected a sort of a shift of RN roles away from the hospital and into ambulatory care roles, but it's a little bit puzzling that we don't see that in the actual data yet. But I still think I wouldn't say it's not happening. You know, it takes quite a while for healthcare organizations to change the way they do things and to even find out what roles they need, and then to put up job announcements and to hire and then to figure out how to use people. So I still think that that's probably a likely shift, and we just really don't know how big it might be.
Okay, great, Dave. I have a couple of questions that are kind of clarifying in nature. I believe they
Sure.
both relate to this slide that you showed with the red and blue and gray bars of age distribution in the regional
Yeah.
picture.
Should we go back to it?
Yeah, maybe just so that way this question will make sense for everybody. Yep, that's it. So the question is, are these age groups for all RNs that work in all practice areas such as inpatient and outpatient settings? And does this include, are these all employed RNs, or do they include RNs that may not be working?
Good question. I probably should have said this better from the beginning, but all the data throughout this whole presentation is what we call full-time equivalent RNs, which means we take from the data RNs that are working full-time and count them as one body, one full person. RNs that are working between 0 and 30 hours are counted as a half, so that's a part-time. So these are all essentially those numbers of FTEs, and they're weighted in that way. That makes a lot of difference, especially in that over 50 category. Whereas if you have an RN who is in their 70s that's working half-time, they're only counted as a half in those bars. But that's definitely an important question.
Okay, and then does this include all nurses working in all settings?
Yes, it does. And I looked this up yesterday. This is just another interesting factoid that we have known that older nurses are less likely to work in the hospital, and so think of that also as you see some of these trends. But the way the numbers turn out, it's about 80% of RNs under 40 are working in hospitals, those blue bars. But it's about 70% of RNs over 50 that are working in hospitals. That's about the way those numbers break out. So a much higher proportion of those older RNs are in the non-hospital settings.
Great, good clarification. This one is also kind of a clarification of nature, but more just in general. Do you have any data on the distribution of nurses by specialty, such as OR, labor and delivery, ER, ICU?
Oh, great question. You know, this is a good pitch to bring back the National Sample Survey of RNs. In the data set that we are now using, ever since they discontinued that data in 2008, that survey, which was put out by HRSA every 4 years, it had exactly those kinds of divisions as to the specific setting where the nurse worked. But we now are using census data that is general to the full population and doesn't have that level of division. So anything we want to know about OR, labor, delivery, and so on ends in 2008. But we also do know that HRSA is going to restart that survey in some form, and I don't know exactly the details of the when and the what. Good question.
Great. I'm going to switch over. I have a couple of questions about wages. Do you anticipate wage compression as the bulk of the workforce has BSN degrees?
That's a good question too. Yeah, whoever's asking that it sounds like they're certainly aware that the BSN nurses on average earn more than ADNs. It's about, I think it's on the order of about 5,000 to 10,000 per year, maybe closer to the 10,000. And you know, right now I believe the workforce is something like 50-50 in terms of the distribution by degree. And these are, of course, I'm just considering the RNs who are not advanced practice RNs. And you know, as more and more get the BSN degree, yeah, there'll be some reduction in the variation. I guess that's inevitable. Yeah, that's a good point.
And I think we got this question exactly the opposite way.
Okay.
You indicated that average salaries had dipped of late. Do you think this trend might continue and eventually suppress supply?
Yeah, I think so. there, I think that's in reference to the one of, the declining real wages by region. And I didn't show this for the overall national picture, but sort of draw a line, through the middle of that, and it is drifting downward. And do we think that it's going to at least flatten or perhaps grow again? It's really hard to say. There's a lot of things that are underneath these curves. I mean, one thing to keep in mind is that when an older nurse retires and is replaced by a younger nurse, that's going to look like a decrease in wages because there is some increase in earnings that comes with experience, and there is a lot of that going on right now, a lot of that kind of replacement influx. But if we looked at this picture for controlling for that, wages still are surprisingly flat, and it's really hard to know. It's a lot about the interplay of supply and demand that will decide whether those wages are going to drift up again. And it's about kind of the value. And I know that Pete and others talk a lot about the increasing importance of showing value on the part of healthcare organizations. And I don't have too much to say on that topic, but it's certainly a good question as to whether those wages are going to turn around, because to some people it's surprising that supply has continued to go up to the extent that it has, even without strong wage growth. But you have to think about that in terms of the economy overall. I mean, wages have not tended to be growing in the economy overall for a long time either. So consider that too.
Great, thank you. Do you have a sense of how these recent trends vary by gender?
That's a good question. We do certainly track the proportion of the workforce that is male, and I can tell you that it inches up ever so slowly. I think last year we're up to about 11% of full-time equivalent RNs are men. But I don't think that I can't tell you right now how these patterns and these trends are different if we just isolate the men and look at where are male RNs working and what is their regional distribution and wage experience. So I don't have a lot to say about that, but it's something that if the questioner has a hypothesis or something to look into, it's a topic that we could certainly learn more about.
Great. I have a ton of questions about impact on education, so I'm going to go ahead and start wading into them tentatively here.
Great.
First one, is there an increase in the rates of RNs moving into advanced practice roles? So, if so, impact on projections?
That's a good one. We did look at that in the forecast paper that I believe we have the citation on the bottom. Yeah, there it is. You can see on this slide. We did do a separate forecast for where we did our best to exclude the APRNs, and that analysis did suggest that yes, as we all might expect, there is a growing proportion of the workforce that are going on to get a master's and become an APRN of some type, or even a PhD. I think something like 8-9% right now have at least a master's degree, and I think that we project that to go up to 10, 11, 12% by 2025. So as that shift occurs, you do see a little bit slower growth if you exclude those folks and just focus on the non-APRN nursing workforce. The growth is a little bit slower, but given that we're still talking about the vast majority of RNs are not APRNs, so it's not like it changes the picture in a way that you come away with a different conclusion. So I would forward the folks to the paper at the bottom to see more detail, but it's certainly a factor, but it's not a major one.
Okay. Do the projections on future supply assume a continued growth in educational output or a leveling off of the educational output?
Yeah. Sorry, what was the question exactly? Because we do see this leveling off of educational output. Is that?
So, yeah, so do the projections on future supply assume a continued growth in educational output or a leveling off of educational output?
They assume something right in the middle. So let me go back actually to the one where we show the number of graduates, not the test takers. I guess I didn't exactly sum the red and the orange line there of the number of degrees by type, but if you do that, our model assumes fairly explicitly that the sum of those two, that the total number of graduates or new entry is going to be pretty much the same as well, take the trend in the last 5 years, so 2010 through 14. Find that average, and then we assume that that average is going to be projected forward. So the fact that there's actually a rising trend from 2010 to 14, it means that our model is assuming that educational trends are going to come off of that peak a little bit. They're even going to come down a little bit to maybe around the 2012 level. So I would say that's a fairly conservative projection in a way. But as long as we don't see a dramatic drop, down to like the 2010 level or below that, then we should still be, that our forecast should be pretty accurate.
Okay, great. On the education piece, my understanding here is a critical shortage of nursing faculty who are critical to maintaining the supply of all of these RNs. Would this factor into the equation?
That's a good one too. We heard a lot about the faculty shortage as being a kind of a bottleneck to workforce growth in the early 2000s, and it doesn't seem, it seems that somehow the people have found the faculty, and I can't really speak to whether that has been inadequate in a way, but it seems like that didn't turn out to be the factor that some thought it would, and we've managed to pretty much double the output of nursing schools in about 10, 12 years. Now, I don't know if those dynamics have changed. It's really not something that I know a lot about. I know that the number of doctorally prepared RNs has also increased at a very rapid rate. Some of those are DNPs who might not be teaching, but some are PhDs as well. I don't know if there's anything to add on that, Pete, perhaps you could chime in, but I don't know too much more on this topic.
Yeah, I'm sort of in the same camp as you are, Dave. It is a little surprising that we've had such a production of new nurses given these earlier concerns about retirement. Now, maybe it is the fact that we're going to see the retirements of the faculty happening, relatively soon. And we may have a little more time with the workforce, so we may not get to experience that abrupt halt in that faculty. So that I think it's worth our team looking more into, because we frankly haven't done a lot of look at that. So that's all I can add in.
Okay.
Great. Since a smaller shortage or even a small surplus has been projected, do you think this will affect federal funding for nursing education?
Ooh. That's a great one, and I don't think I'm in a position to speak much to that. My sense is there are a lot of factors that go into those decisions, and not so much driven by projections of shortages, but a lot of it is, I think, on the distribution of, do we have RNs where we need them in and with the right kinds of education. But yeah, that's a very good question.
Great. Let's see here. Kind of in the same vein, you may not be able to answer this, but I'll let you see if you think this might happen given the data.
Sure.
Do you foresee a movement in the near future to eliminate or at least reduce the number of ADN schools or programs? Many graduates are having trouble finding jobs in the hospital. Of course, this varies regionally, but do you think that might be a trend we're looking at?
Yeah. I mean, I wouldn't put it quite that there's going to be some movement from some top level to. I mean, there's really nobody in charge of how many ADN nursing degree programs or how big they are. But in terms of if there are just fewer people applying to and enrolling in these programs because of the kinds of signals that they're getting and the difficulties getting jobs, I think those programs will start to shrink organically. I do think that will happen, and it's hard to know. It's hard to know to what extent. I mean, and it's also true that a lot of people do go to those programs, and then at some different time, will enroll in one of the programs to then get a BSN. As a two-step process. I think there's always going to be interest in that. So no, I don't think these programs will go away entirely. But following the recent trends, I do think that they will be less popular. Yep.
Okay, and just quickly, I had a request to go back to the question slides so we could get your contact info.
Sure. Is that one at the end? Yep.
Yeah.
Yeah.
Okay, and then I'm going to go here to a comment. This will provide some perspective from Kentucky. In Kentucky, we're seeing a return to recruitment bonuses throughout the state. There are shortages of nurses in general, and especially in specialty nurses, OR, ED, labor and delivery, etc. Yet, HRSA projected us to have a surplus in their December 2014 report. Our ADN programs cannot fill student slots due to lack of interest in the rigor of nursing programs. Our new nurses are enrolling in APRN programs immediately upon post-BSN graduation. Maybe any comments on hearing any of that similar echo, Peter or Dave?
Kentucky. Yep, that sounds like, at least if that sounds like kind of the perfect storm of a supply problem. It's true if all of those things are going on at once. If you have rapidly declining entry into some of the programs like the ADN programs, and if you have a lot of people going into become advanced practice RNs at the same time, and if all of these things tend to be happening at once in an area, that could certainly make for a difficult time. I mean, the HRSA projections are, they're sort of like ours. They're done through national level data, and they're only going to be predictive at the very fine level. Probably, there are just going to be local differences that no model is able to fully handle. And I would say, in the big picture, 5-10 years out, those models are reflective of some of the bigger trends going on, and I don't think that the situation the commenter is referring to is going to be necessarily a long-run problem, but I certainly believe. I mean, that sounds like definitely a disruptive situation in the medium term. And we'd love to hear more about that, especially if you have some data that you can share with us.
Great. I have one other similar comment to that from Louisiana, but I want to take this question really quick because I know we're getting out of time.
Yep.
Increasing issue is not volume of RNs, but serious imbalance in terms of experience needed. There's a limit on the number of new RN hospitals and healthcare can absorb. Can you say research about the issue of the experience gap and mismatch we're facing?
I'd like to pitch that one to Pete. Yeah, the experience gap is definitely something that I've kind of sidestepped through a lot of this, but I'm sure it's very salient to a lot of folks, especially as you have this period of lots of retirement and lots of new entry at the same time, and we can't pretend at all that suddenly that experience just magically. Do you have any thoughts?
I think, I think it's really an amazing thing that overall, I think the picture, Dave, that you're presenting is a much better picture than what we saw years ago, particularly in 2015. But now we're on the, the next 10 years, we're going to see this withdrawal of all these experienced nurses. It's 1 million nurses. And it seems to me we ought to be looking at how we could retain many of those nurses that are leaving because their bodies have worn out or they just need less hours, but they want to be in nursing, they want to continue. And I think there could be a tremendous opportunity to help educate and bring on the younger nurses into the workforce. And I really hope we could do that. There may be opportunities for hospice care and other areas that these nurses could be working in. The same would be for the physician workforce as well. I think that, did that get at the question? Because I was a little bit interrupted in the background when I heard half the question.
Yeah, I think that's right.
Okay.
Okay, I'm going to take one more. There's so many good ones left. I'm just trying to figure out what would be the best note maybe to end on. I'll go with I'll go with a question about test takers. On the slide with the current and projected trends in entrance and exits, it shows the inflow at about 100,000 to 120,000 per year. However, the new NCLEX passers are about 150,000 per year. Thus, wouldn't the supply be even higher than what we might be projecting?
Are they? Okay, I might be referring to the 150,000 we see here in the number of test takers and comparing to this slide. Is that what you think is the questioner is talking about, Christy?
I think so.
Where we have the entry that's more in the order of 110,000. Yeah, and that is just that gap there is a factor of the fact that not all those test takers pass, and not all of them actually even work in nursing at all. Some will then, we know some will go into other fields, other careers, and this line also reflects those who might be working part-time. So a lot of younger RNs especially are taking time out for childcare or other things. So all of that is reflected in. Sorry. Yep. All of that is reflected in the difference between the 150 and these blue bars. Are we still on?
Christy? I'm not sure. I think we may be.
Okay.
Christy may have dropped off, but could I just interject one thought, Dave, as we're bringing this to close? We began this by saying, man, there's an awful lot of chatter.
Can you guys hear me?
About yeah.
Yes.
A lot of chatter and discussion about reemergence of workforce shortages and the retirement cliff and all those things. And I just sort of thinking here, we're in a different world now of communication, tweets, retreats, retreated retreats, and things just get moving around. And I think we have to be a little bit careful about what we're hearing and thinking that, oh, that reflects my world. And maybe it doesn't. So, and when you get a lot of perceptions out there in a marketplace, that can actually have an impact on people's decisions to go into nursing or not go into nursing, those kinds of things. So I just would sort of am more alert today than I ever have been to think about what it is I'm hearing and reading and relate that to my situation and making a careful evaluation. Does that news story really reflect my world? And then, just sort of step back and take a deep breath. Because we're not seeing it from a national picture. Not to say that there are problems out there, but nationally, it just doesn't look to be that picture at the moment. Would you agree, Dave?
Yep, I think that's a good point to end on. It's true.
Okay,
Great.
Christy, are you there?
I am. Sorry, I had a
Right.
and I'm sorry if I interrupted anyone trying to figure out where my audio went. Thank you to everyone who logged questions. We had a ton we didn't get to. Just one that kept coming up was, I think we will not be making the PowerPoints available for this presentation due to some pending possible manuscripts. But we did record the presentation today, so you're welcome to come back and access the information at our video library that will be posted by the end of this week. Thank you so much, and we appreciate all of your attendance, and we'll be having another exciting webinar in March, so stay tuned for details on that. Thanks, guys.
Thank you.
Great.